If you are taking amlodipine, losartan, or lisinopril for your blood pressure, this video is going to give you information that most doctors simply don't have time to explain during a 10-minute office visit, and that most patients never receive clearly enough to actually use. These three medications are among the most commonly prescribed drugs in the world for people over 60. Millions of seniors take them every single day, trusting that they are managing their blood pressure effectively and protecting their heart and kidneys in the process. And in many cases, they are. But there are critical things about how these medications work, how they interact with food and other drugs, what warning signs to watch for, and why certain common habits can silently undermine everything these medications are trying to do that most people on these drugs have never been told. Stay with us until the end of this video, because the last thing we cover is the one that surprises almost every senior who hears it, and it may be the most practically important piece of information in this entire video. Let's start by understanding why blood pressure management matters so urgently for seniors, because this context makes everything else in this video feel more real. High blood pressure, or hypertension, is often called a silent condition because it rarely produces noticeable symptoms until it has already caused significant damage. The damage it causes over months and years of being inadequately managed is not subtle. Uncontrolled high blood pressure is one of the leading causes of stroke, which can permanently impair movement, speech, and cognitive function. It is a primary driver of heart attack and heart failure, causing the heart muscle to work under excessive strain until it begins to weaken. It accelerates kidney disease by damaging the tiny, delicate blood vessels inside the kidneys that filter waste from the blood. And it is increasingly recognized as one of the major contributors to vascular dementia, the form of cognitive decline caused by reduced blood flow to the brain. Amlodipine, losartan, and lisinopril exist to prevent all of these consequences, and when they work well, they are genuinely life-extending medications. But making them work well requires understanding them well, and that is exactly what this video is about. The first thing many seniors don't know is how differently these three medications actually work inside the body. Amlodipine belongs to a class called calcium channel blockers. It works by relaxing and widening blood vessels, reducing the resistance the heart has to pump against, and in doing so lowers the pressure inside those vessels. Losartan belongs to a class called angiotensin receptor blockers, or ARBs. It works by blocking a hormone called angiotensin II, which is one of the body's most powerful natural blood vessel constrictors. By blocking this hormone, losartan prevents the blood vessel narrowing and fluid retention that angiotensin II would otherwise cause. Lisinopril belongs to a class called ACE inhibitors. It works slightly differently from losartan but through a related pathway, blocking the enzyme that produces angiotensin II rather than blocking the receptor it acts on. Understanding these different mechanisms matters because it explains why they have different side effect profiles, why they interact differently with foods and other medications, and why what one person experiences on amlodipine may be very different from what another person experiences on lisinopril, even though both medications are treating the same underlying condition. The second thing many seniors don't know is that amlodipine can cause ankle and leg swelling in a significant proportion of people who take it. This swelling, called peripheral edema, is not a sign of heart failure or kidney failure, though it can look similar from the outside. It happens because amlodipine dilates blood vessels, and in some people this dilation allows more fluid to leak out of the small blood vessels in the lower legs and pool in the surrounding tissue. Many seniors who develop this swelling assume it is simply a sign of aging or attribute it to other causes, and never connect it to their medication. Others discontinue amlodipine on their own because the swelling is uncomfortable without informing their doctor, which disrupts blood pressure management. If you or someone you know has developed new or worsening ankle swelling while taking amlodipine, this is worth reporting to a doctor specifically in the context of the medication, because there are management strategies available and in some cases an alternative medication may be more appropriate. The third thing that deserves attention is the dry cough that many people develop on lisinopril and other ACE inhibitors. This cough is caused by the accumulation of a compound called bradykinin in the respiratory tract, which happens because ACE inhibitors block the enzyme that would normally break bradykinin down. The cough can range from mildly irritating to genuinely disruptive, and it can develop weeks or even months after starting the medication, making many people fail to connect it to their prescription. Doctors frequently hear patients describe a persistent cough they have been attributing to allergies, a lingering cold, or reflux, only to discover when asked that it began after they started lisinopril. For people who develop this cough, switching to a medication like Losartan, which works through a related but different mechanism and does not cause this cough, often resolves the problem completely without sacrificing blood pressure control. The fourth thing seniors need to know concerns potassium, and this is where Losartan and lisinopril require particular attention. Both of these medications can cause potassium levels in the blood to rise, a condition called hyperkalemia, by affecting the hormonal pathways that regulate how the kidneys handle potassium. For most people, this effect is mild and clinically insignificant when monitored appropriately. But potassium is directly involved in the electrical activity of the heart, and when levels rise significantly, they can produce dangerous heart rhythm disturbances. The risk becomes particularly relevant when these medications are combined with potassium supplements, potassium-containing salt substitutes, or other medications that also tend to raise potassium, such as certain diuretics. Many seniors are using potassium-based salt substitutes to reduce their sodium intake, believing this to be a healthy choice, without realizing that for someone on Losartan or lisinopril this combination can be problematic. This is one of the most important food and supplement interactions for seniors on these medications to be aware of, and it is one that doctors frequently don't mention during a routine prescription renewal. The fifth thing that matters enormously and that very few seniors are explicitly told is what researchers call the triple whammy effect. This term describes a specific and well-documented dangerous interaction between three common medication categories: ACE inhibitors or ARBs like lisinopril and Losartan, diuretics like furosemide or hydrochlorothiazide, and nonsteroidal anti-inflammatory medications, which include common over-the-counter pain relievers like ibuprofen and naproxen. When all three of these are used together, their combined effect on blood flow to the kidneys can be severe enough to cause acute kidney injury, sometimes requiring hospitalization. Many seniors take all three of these categories simultaneously without any awareness that this combination carries this level of risk, because each medication was prescribed or purchased separately, often by different providers or at different times, and the interaction between them was never clearly explained. If you are on lisinopril or Losartan, take a diuretic, and use over-the-counter anti-inflammatory pain relievers regularly, this specific conversation with your doctor is one worth having urgently rather than at the next routine visit. The sixth thing seniors on these medications need to understand is the concept of sick day rules. When the body is dealing with a significant illness that causes vomiting, diarrhea, or reduced fluid intake, the normal safe dose of Losartan or lisinopril can become too much, because dehydration in combination with these medications can place the kidneys under significant additional stress. Many clinical guidelines now recommend that people on these medications temporarily withhold them during acute illness if they become significantly dehydrated, but only under a doctor's guidance rather than as a personal judgment call. Knowing that this situation exists and that it has a management approach is something every senior on Losartan or lisinopril should be aware of and should have discussed with their doctor before the situation arises. The seventh area of concern involves how blood pressure is actually being measured, and whether the readings being used to manage medication dosing are accurate. Blood pressure readings taken in a clinical setting are frequently higher than a person's true resting blood pressure due to the anxiety and stress associated with a medical visit, a phenomenon known as white coat hypertension. Conversely, some people have blood pressure that appears controlled in the office but is elevated at other times, a phenomenon called masked hypertension. Both of these patterns mean that medication dosing decisions based on infrequent office readings can be either too aggressive or insufficiently aggressive compared to what the person actually needs. Home blood pressure monitoring, done consistently with correct technique at the same times each day, gives a far more accurate picture of whether medications are actually achieving what they are intended to achieve. The eighth thing many seniors don't know is that falling blood pressure, rather than high blood pressure, becomes an increasingly important concern as age advances, and that the medications designed to lower blood pressure can sometimes lower it too much, particularly in the context of aging physiology. Orthostatic hypotension, the sudden drop in blood pressure that occurs when standing up from a sitting or lying position, becomes more common with age because the autonomic nervous system's ability to compensate quickly for postural changes becomes less precise. When blood pressure medications push overall blood pressure to levels that are low even when seated, the drop upon standing can be significant enough to cause dizziness, lightheadedness, and falls. Falls are one of the most serious injury risks for seniors, and blood pressure medication is one of the most consistently identified medication contributors to fall risk. If you have experienced dizziness when standing, particularly since starting or increasing blood pressure medication, this is a symptom worth reporting rather than normalizing as a side effect you must simply live with. The ninth and final thing, the one that surprises the most people, is that blood pressure medication does not cure or reverse the underlying causes of hypertension. Let's also spend a moment on something that ties together several of the points we have already discussed, which is the importance of medication timing and consistency beyond simply remembering to take the pill each day. Blood pressure follows a natural daily rhythm, typically lowest during overnight sleep and rising sharply in the early morning hours just before and after waking. This morning rise in blood pressure, sometimes called the morning surge, is associated with the cardiovascular events that tend to cluster in the early morning hours, and managing it effectively is one of the goals of blood pressure medication. Whether a medication is taken in the morning, the evening, or split across the day can meaningfully affect how well this morning surge is controlled. Some research suggests that taking certain blood pressure medications in the evening rather than the morning produces better 24-hour coverage and better protection against morning blood pressure peaks. This is not a universal recommendation and depends on the specific medication and the individual, but it is a conversation worth having with a prescribing doctor. The role of sodium intake in blood pressure management alongside these medications is another area where most seniors receive insufficient guidance. Sodium causes the body to retain fluid, which increases blood volume and therefore increases the pressure inside blood vessels. A diet high in sodium works directly against the blood pressure lowering effects of amlodipine, Losartan, and Lisinopril, meaning that a person taking their medication faithfully but consuming large amounts of processed food, restaurant meals, or heavily salted home cooking may be partially or completely undermining the medication's effectiveness without realizing it. The sources of dietary sodium that tend to be most problematic are not the salt added at the table, but the sodium embedded in processed foods, canned goods, bread, deli meats, soups, and restaurant meals, where it is invisible and often surprisingly high. Many seniors who work hard to take their medication consistently would benefit equally or more from a serious conversation about sodium reduction, yet this dietary guidance is often given only briefly or not at all during routine blood pressure management visits. Alcohol consumption is another lifestyle factor with a direct and significant effect on blood pressure that interacts importantly with these medications. Regular alcohol consumption raises blood pressure, and the blood pressure-raising effect of alcohol is strong enough that people who drink regularly often need higher doses of medication to achieve the same control as those who abstain or drink minimally. Beyond this direct interaction, alcohol can affect the metabolism of certain blood pressure medications and enhance some of their side effects, including dizziness and orthostatic hypotension. For seniors who drink regularly and are struggling with blood pressure control, reducing alcohol consumption may allow for meaningful reductions in medication dose. And this is a conversation that happens far less frequently in clinical practice than its importance warrants. The importance of regular monitoring beyond office visits deserves more emphasis than it typically receives in standard blood pressure management discussions. Blood pressure is not static. It fluctuates throughout the day and across different situations, and occasional office readings provide only a small window into a highly dynamic measurement. For seniors on amlodipine, losartan, or lisinopril, home blood pressure monitoring done correctly and consistently, using a validated arm cuff device rather than a wrist cuff, at the same times each day, after 5 minutes of quiet rest, produces a far more accurate and useful picture of actual blood pressure management than any number of clinical readings. Many doctors now review home blood pressure logs as the primary basis for medication adjustment decisions, and for seniors who are willing to invest in this simple practice, it produces better medication management and clearer evidence when something needs to change. It manages blood pressure by working around the underlying mechanisms that are driving it upward, but when medication is stopped, blood pressure typically returns to where it was before treatment. This is why consistent daily adherence matters so enormously, and why the very common practice of taking medication only on some days, reducing the dose without medical guidance when blood pressure looks good, or stopping medication entirely when feeling well, can be genuinely dangerous. Blood pressure can rise rapidly when medication is discontinued, and the consequences of this sudden rise can include stroke and cardiac events. This is not a reason to feel trapped by medication. It is a reason to understand clearly why consistency matters, and to have regular conversations with a doctor about whether the dose, the medication, or any lifestyle factors can be modified rather than making unilateral changes. Before we close, this video is for general educational awareness only. Everything discussed reflects established medical knowledge and research, but it is not personalized advice, and no one should change their blood pressure medication, dose, or routine without direct guidance from their own doctor. Blood pressure management is highly individual, and the right approach for any specific person depends on their complete medical history in a way that only a clinician who knows them can fully assess. If this video gave you information you feel could matter to someone you care about, please share it with them, because this is exactly the kind of practical medication awareness that most seniors desperately need and almost never receive clearly enough to act on. If you found this video helpful, please like it and subscribe to Dr. William Hart Health for more videos like this every day.